Hi everybody, I am Jeremy Hill and I am a student nurse anesthetist, and I'm here in the classroom with three of my 7 girls, Rachel, Lindsay, and Megan. Say hello, girls.
Hello.
We're having a guest speaker, me. We're going to talk about neuromuscular blocking drugs on a 4th grade level, so hopefully this should be fun. And of course this is for the benefit of nurse anesthesia students as well, but I wanted to demonstrate that these can be easy drugs to understand. So first we're going to talk about the clinical uses for neuromuscular blocking drugs, safety concerns associated with them, different kinds of neuromuscular blocking drugs, and how they affect the neuromuscular junction. Explain the reversal for these drugs and the monitoring that is necessary for these patients. So why do we use neuromuscular blocking drugs? Well, there are 3 different kinds of muscle cells, right, girls? What are the 3 kinds?
The
Skeletal,
muscle,
the cardiac muscle.
smooth muscle.
Yep, skeletal, cardiac, and smooth. Well, these drugs make the skeletal muscles relax. Skeletal muscles help us move, and most importantly, they have reflexes in our throat that protect our bodies, as well as a really big important one called the diaphragm that makes us breathe, right? So if we paralyze somebody's breathing muscles and they can't breathe, what can happen? Yes, Lindsay?
They can stop breathing and they can die.
Yeah, if you can't breathe, you can't die, you can't live, right? So you have to be really careful with these drugs too. Only somebody who can put in a breathing tube to help the patient breathe with a machine should be giving these drugs, or else they can be really scary. So we use them to put that breathing tube in. It helps make that job easier. It also makes it so that doctors have an easier time doing surgery. Like if you get something that hurts your body, makes you want to pull away, right? Yeah, well, patients in surgery do that too. And so that can be really dangerous. It can mess up the surgery. And so sometimes we have to paralyze them so that that doesn't happen. Also, sometimes we take pictures of the inside of a patient's body with cameras that are really sensitive to movement. And so sometimes we have to paralyze them for getting better pictures. And there are lots of other really good uses for the medications in ICUs so that patients can be safer or have better care. So lots of things can go wrong with these medications. You have to be really safe. Sometimes patients can be allergic to them, and so we have to treat their allergies. And the most important thing we already talked about, if you can't get that airway in, then it makes it so that they can't breathe and they could die unless there's some way to get out of it, right? There's a reaction called malignant hyperthermia that we'll talk about. And sometimes people can stay paralyzed after surgery for a little bit longer than we expected. Also, medication errors. If we can accidentally give one of these medications when we meant to give something else, like these, they look really similar. One is a paralyzing drug and the other one isn't. So what would happen if you accidentally gave the paralyzing drug? Yeah, Lindsay?
The person could die because it's the wrong drug.
That's right. They could die because it's the wrong drug. So there's a high potential for really bad errors to happen with these. So how do these drugs work? Well, let's look at the neuromuscular junction. Remember, we've talked about in the past how your brain sends electrical signals through what kind of cells? Yes, Rachel?
Nerves.
Nerves, yeah. So electrical signals travel through nerves and it gets to the end where it meets up with a, Megan? What kind of cell does it meet up with? Muscle. It meets up with a muscle cell.
Muscle
Okay.
cell?
So,
Good job.
remember, electricity is just positive and negative charges moving around, right? So when it gets to the end of the nerve, positive charges move in and it makes these molecules get released. They're called acetylcholine. And acetylcholine is kind of like a key, and it travels across and it fits into this lock that's on the muscles. And you see each one has two that has to get on there in order for the lock to turn and the muscle can do its job. So there are a couple of diseases that you have to worry about. Remember, we've talked about autoimmune diseases and antibodies. Well, those the immune system can actually attack the places where the positive and negative charges move in and out of the cells, such as myasthenia gravis, that's one disease, and even Lambert, that's another. And if that happens, what happens if the acetylcholine isn't coming out or it can't get to the muscle? Yeah, Rachel?
Somebody could get injured or die.
They would be weak, yeah. And we have to do things to help them be stronger. And these medications can really affect them too. So we either don't give them or we're really careful with them. Okay, good. So this is a close-up picture of that lock. And again, there are two spots where the acetylcholine has to get on there. Both of them have to have acetylcholine or the lock won't turn. Now these drugs, there are two different kinds. Some of them block those so the acetylcholine can't get to it, and that paralyzes the patient. The other one binds to both of those and turns the lock and makes the lock get stuck open. So then the muscle can't relax, basically. Okay, and so monitoring that we have to do, this is a little machine that we use to test how strong a patient is. We do it first before we give them a medication, and they should be strong. And what we're doing is we're stimulating the nerve and creating an electrical impulse, and that travels to the muscle, which makes twitching happen, okay? So when we give the medication, we see the twitches go away. And the medication eventually will wear off, and twitches start to come back until they get to full strength. This helps us to know, first of all, how effective the medication is. If we didn't give them enough medicine, we'll still see twitches. Also, as it wears off, we can see how are we doing with surgery? Do we need to give them more? Also, it helps us to know if we're ready to give drugs to get rid of that medication. So there are two different kinds. I already talked about that. One of them stops the acetylcholine. The other one makes the lock stay open. Just different time frames that some of these drugs can work. Now, reversal. So if the acetylcholine is still just kind of floating around there, but it can't get to the locks, we give medications called cholinesterase inhibitors to make it so there's more acetylcholine. And that can actually make it so that it can get to the locks a little bit better. These also can make us have bad effects, like having our airways get all tight, or it can give you diarrhea, it can make you pee, it makes you drool a lot. Some of these effects they're not very good for us. It can also slow down your heart rate. So we actually give a medication to get rid of some of those side effects also. Now there's another type of reversal for these drugs, for the depolarizers, that actually binds all of those molecules of medication. So let me just show you a quick demonstration. The mirror is like a muscle cell, and the water is like the non-depolarizing neuromuscular blockers. So this plastic wrap is kind of like, come on up Rachel, is kind of like a reversal drug. Now go ahead and feel that. Can you feel that water? Nope, it feels dry, right? Well, that's kind of how the reversal drug works. It makes it so that you can get your strength back, even though the medication is still there. Eventually, the reversal drug will wear off, and look, you can feel water again, right? Touch it. Does that feel wet? Mm-hmm. Yeah. So that's how drugs like neostigmine work, the cholinesterase inhibitors. Well, this sugammadex that we're talking about is more like a towel. And we can actually remove all of that drug and makes it dry. Go ahead and feel it. Okay. Good. So that demonstrates how Sugamidex works. And the nice thing is that drug is stuck there forever and it goes away and your kidneys get rid of it. Okay? So then, excuse me, so then it can no longer affect the muscles. The other kind of neuromuscular blocker is succinylcholine. And remember, this one binds to the lock and keeps it, it jams it open, right? It works really fast. And it also wears off fast, which is nice. So there's actually no reversal drug for this one. But there are a couple things that you have to worry about with it as well. It sounds like a great drug, but there are a couple things where we have to be careful with it. So if you give too much of it, it can act more like one of the other ones and makes it so more acetylcholine can't stimulate those blocks. So it can't get to it. Also, a bad effect, I put a family tree on here because this one's really related to family history. If people get malignant hyperthermia, then everyone else in their family needs to be really careful with this drug because it can actually cause increased carbon dioxide in your body, which is really bad. It can make your heart race, makes all your muscles get really tense. And remember I talked about shivering before? When your muscles are working like that, it creates heat, right? Your body shivers to try to warm up. Well, when your muscles are working so hard, it makes lots of heat. And that heat can't get out. So what happens is you get a really, really bad fever and it can kill you. So there's medicine that we can give to try to fix that. But that's something that anesthesia providers have to be careful with. And one last thing about succinylcholine is there are some patients that you shouldn't give it to. Patients who have kidney disease, or elevated potassium, it's just some of those positive and negative charges. They're out of balance. Also, patients who have had strokes, neurological injuries, and of course, family history of malignant hyperthermia. Also, pseudocholinesterase deficiency. Remember, I told you the succinylcholine gets broken down really fast, so it wears off. You don't need reversal. But some people don't have enzymes that are needed for breaking those down. And so the medication can actually last longer than we expected, which is why there's a clock, because it can take hours and hours, sometimes even days, for that medication to wear off. And that's all I have. Do you have any questions? Yes, Rachel?
Earlier, when you were talking about something that's hurting you, and you pull something away,
Yep.
That's what happened when Mom was cleaning out my ears.
Yeah, Mom was cleaning out your ears and it made you pull away, right? Yes, Megan.
Dad, remember how Lindsay got her broken finger? There's something that you were talking about that kind of sounded like it. That's why I raised my hand in the middle of that thing.
Okay, very good. All right, guys, thanks. Hope you enjoyed the video. It went a little longer, but there's a lot of information, so hopefully that it works out okay. But hopefully you enjoyed it and benefited from that information. Thanks, guys. Say goodbye.
Bye.
Bye.